Hello and welcome, everybody. My name is Fiona O'Farrell, and I am the program chair of the Marriage and Family Therapy Department at Pacific Lutheran University. I am super excited to welcome you to our info session. Of course, we would love for you to come in person to one of our open houses or attend a live info session if you'd like to attend remotely. And our admissions counselors are always available if you have follow-up questions about anything that we talk about today. So let's jump right in and talk a little bit about our program mission. A few things for you to know and think about when considering PLU. First of all, broadly as a university, one of our missions and kind of priorities is educating students for lives of thoughtful inquiry, service, and leadership, and care for other people, their communities, and the earth. I was really impressed when I came here as a faculty member and was introduced to PLU's kind of operating stance, which is helping people to live meaningful lives through purpose. And I think that our program echoes what the larger university mission is around developing a purposeful approach to our work as systemic therapists or marriage and family therapists. Then if we go a little further and examine our own marriage and family therapy program mission, the mission of our MFT program at PLU is to train students to become systemically oriented and contextually sensitive MFT professionals who address the diverse needs and clinical concerns of individuals, couples, families, and communities. I think it's important that we take a moment here and just acknowledge that marriage and family therapy, or the field of marriage and family therapy, has a little bit of a branding and marketing issue right now. So just to be clear, marriage and family therapy is the term standard for our licensure in Washington State and in most places in the United States. And so historically, marriage and family therapy has been used, even though it really isn't representative of what our field actually encompasses. Marriage and family therapy is better known or more explained by family systems theory or systemically oriented therapists, which means that regardless of the unit we're working with, this could be individuals, this could be children and their families and parents, this could be folks in relationships, or it could be broader or larger systems like communities or institutions, that we're always paying attention to the relational unit. So what happens between two or more people, rather than focusing on individual change, we are looking at systems oriented change or broad change between and among more than one person. Let's talk a little bit about some of the learning outcomes for our program. Hopefully by the end of the program, some of the things that our students come out knowing is how to be systemically oriented MFT professionals, contextually sensitive MFT professionals committed to diversity and inclusion, MFT professionals in the community mental health context that practice ethical and effective therapy, and professionals who identify strongly as marriage and family therapists or systemic therapists. Of course, you can see this more fully on our website. If you go to the PLU MFT webpage, there's a lot more information here. Next, let's talk about accreditation. Our program is co-AMFTE accredited. This is the Commission for the American Marriage and Family Therapy accreditation body. And that means that we are overseen and standardized by AMFT and the Commission on Accreditation. We also have some benefits as a co-AMFTE accredited program, which means that when you graduate from our program, up to 500 hours of direct clinical work and 100 hours of supervision in your time in the program will count towards your Washington State licensure. And this is a benefit. Folks who come from non-accredited programs have double the amount of hours to get post-grad as you do if you come out of a co-AMFTE accredited program. We are one of the 5 co-AMFTE accredited programs in Washington at this time. So after graduation, you will qualify to apply for what's called an Associates of Marriage and Family Therapy license here in Washington State. You'll take the national licensing exam. This is an exam that is standard across all states except for California. And then you will be required to do supervision while you accrue your remaining hours towards your licensure requirements. There are a few places you can find out more information on this. One is the DOH website for Washington State. I'll talk a little bit more about some of the licensing considerations later on in the presentation. But the most important thing for you to know here is, in general, whether you plan to practice in Washington or elsewhere, attending a COAMFD approved program is going to be a standard by which most state licensure requirements either respect or actually will give big benefits, or you will get kind of more direct routes into licensure if you come out of a COAMFD accredited program than if you go to a non-accredited program. I talked about this a little bit already, but our program is completely grounded in a systemic orientation. That means that we look at relationships as the primary lens for the work that we do and the primary lens for the change that we believe is possible. This means that we work with multiple people in the room, couples, families, colleagues, any kind of relational unit. This could be intimate relationships like families or romantic partnerships, or this could be platonic relationships like friendships, or even like workplace relationships like colleagues or institutions or organizations, anything like that. Our program also encourages and supports the students that attend our program, who we call clinicians in training, to prepare themselves to work with more than one person in the room. I want to speak to this for a moment because we've been overjoyed to know that mental health is finally being recognized as a necessary and important aspect of people's health and wellness. And because of third-party payers and insurance companies and the medicalization of healthcare in particularly in the United States, but globally, it means that they prioritize working with individuals in mental health care. And so we have a really unique and special training background in which we are trained and prioritize working with more than just the individual, and really focus on the individual in the context of the systems or the relationships that they're in. This is also what makes us totally unique. Both at PLU, we're unique in this because we really, really focus on this. Our program is oriented and grounded in this, but it also makes our field unique. We're the only professional field in mental health and behavioral health where your training is about a relational focus and working with relationships and systems. A little bit more about what makes our field unique is that when we're trained to look and work with our clients systemically, it means that when we look at their mental health and wellness, we think of it situated in the context of our relationships or the larger systems that are at play. MFT, like I said, is a little bit of a misnomer. It's misnamed. Marriage and family therapy does not really capture what we do. We work with relationships and families, but we see every single type of treatment unit through the lens of who they relate to and who they spend time with. We work with all of the same diagnoses and mental health challenges that other providers do, like anxiety and depression, all the way up to other diagnosable or more kind of higher needs, mental health illnesses, and family needs. Our field is expected to grow by 22% by 2028, and it is on the rise. We see more and more folks leaning into systemic thinking and systemic training every single day. A lot of the folks who are not trained systemically post-grad will seek additional training for this work because of how valuable it can be. A few things to really understand about PLU's program specifically. One is our Couple and Family Therapy Center, also known as the CFTC. This is our on-site clinic that serves the community where when you start your practicum work, you will be working with folks in relationships, families, individuals, relationships like couples who are coming to work with you, and you get hands-on experience at our on-site clinic where you also get a ton of support. So when you start seeing clients who start at the clinic, eventually you'll move to doing your practicum placements offsite or your internship sites. But when you start at the CFTC, what's really lovely is you're there with all of your cohort members and your colleagues. Most of our students start off in what we call co-therapy dyads. So they're working with another therapist. So we bring that system not only in who we work with, but we bring that dynamic in terms of the therapeutic team as well. And then we also have live observation and supervision from your supervisors and from other folks at the clinic. So you have just so much support and a ton of hands-on training pretty early in your training and work together. And it is something that's really unique about our program is that everything happens on site and is available to you here. The next is that we are really committed to and we value diversity in every sense of the word. Honestly, what we are committed to is helping people bring forward the intersections of their identities, both in terms of therapists understanding their own intersectionality and how that comes forward in their work, but also being able to hold the complexity of the intersections of the identities and the experiences of our clients. And that this is kind of thread through every single course and every single value that we have as a program. You'll get a lot of support in exploring and expanding your work from a contextual and diversity informed lens. We also have a cohort model. I personally think that being in a cohort is just so wonderful. You get to know one another. You start to build a little bit of of your own kind of system or family as you're going through grad school. Our cohorts tend to be about 22 to 25 students. So we've got really nice small in-person class sizes. Everybody gets to know one another and you move through the training all together. So over time, you really get the benefit of being within an in-person cohort community. Finally, we put a lot of time and energy into your practicum placement. So I mentioned this earlier, but you'll start at the CFTC. And then after your first full semester in the couple and family therapy, then you'll start to get placed at an external internship site or your practicum placement. We build really strong relationships with the organizations and institutions that we work with as your sites. And we go through a very intentional pairing process where both you and the site get to interview and rank one another. And your interest in your site placement is heavily considered. And we try to do our best to really pairing our students at sites where we feel like they'll really grow and develop in a positive way. Finally, we have really great outcomes. Almost all of our graduates pass the national licensing exam once they take it. Most of our graduates are out in the field working as systemic therapists or MFTs in some capacity. And we also have a really strong alumni group. So once you come out of the program, you're kind of never done with PLU. We have the Counselors of Color or Plus conference that we have every year that's open to the community and to our past alumni. We do ongoing events that help to keep alumni connected to our program. So there are just some really great outcomes. Generally, you will know if you encounter a PLU grad. They're they like to acknowledge that they came out of this program. So where can MFTs work? Basically anywhere that a behavioral health or mental health therapist would work. Some of the most common places would be community mental health agencies or community clinics, group practices, which are on the rise. So this is kind of the middle between a community clinic or a hospital setting and a private practice that's usually one or two practitioners. Group practices help increase accessibility to insurance reimbursement, access to health or to mental health care for our clients, and you usually get the benefit of working with colleagues and in a group. And we're seeing more and more of those be one of the places that we serve our community here. We also have opportunities to work at hospitals or substance abuse centers. Very common to have MFTs get placed at schools, especially with schools that have agreements with agencies or community clinics where they want on-site mental health support for the kids attending the school. Another common place is churches, colleges, something like a student counseling center, And there are just so many more. I'm always amazed at the folks that I meet that have a degree in marriage and family therapy and what they're doing with their professional career. It's always really fascinating. I love meeting folks who work at larger organizations, working from that systemic lens on an organizational level. And then, of course, for some of us, we go into teaching and program development, family advocacy, or working on that kind of level. So there's just a lot of opportunities for folks. Some of the benefits of getting a degree with us, and particularly, again, an accredited degree, is that the field of MFT and generally credentialed mental health providers is in really high demand. Of course, we saw a huge spike in conversation around this with the pandemic, and it has only continued to grow. Currently, there are still not enough providers to meet the demand for how many people are seeking services. Most of our MFT students get jobs right after graduation, or actually even before they graduate. The salary does range between about 58,000 per year to 78,000 per year, and that's a beginning salary, just to clarify. That's a starting salary after you graduate. And students who graduate from our program and sit the exam have a 100% passing rate. Okay, so this is where it gets kind of interesting. Again, one of the things that actually makes PLU rather unique is that we are a full in-person program. So I know that with the pandemic, it has given an opportunity for folks to access learning remotely. And there's like a couple of courses that you'll take remote while you're doing your practicum, and you receive supervision, which is like consultation for the clients that you're working with. This is done remotely and over Zoom, and there are a few other things, but for the most part, for your full kind of integrated classes, those are in person on campus. We find that this really benefits our students because of the relationships that are formed, but the attention that they can give to in-person learning and the desire for community. It also increases their ability to work with clients in person after they graduate because they've had the experience of working both online and in person. And we're seeing kind of a big return to more and more interest in receiving in-person learning. Of course, we have a full and robust team at the university that can support you if you have any accessibility needs or any particular learning accommodations. That's something that we have integrated in our program as well. Our program can be completed in as few as 2 years or as long as 2 years and 1 semester. Generally, the first year has the most consistent schedule where the whole cohort will be all together in person Tuesdays and Thursdays from 3 p.m. to 6:20 p.m. So 2 days a week for about 3 hours a week. And then that is the in-person learning time. Plus, there's also outside reading and homework for those 3 hours of class. And then during your second year is when you start working at the CFTC, and then also start at your internship sites. And so what happens then is your classes for the cohort move to Wednesdays because you'll plan for about 20 hours a week of clinical work in addition to your classes on Wednesdays. All of the didactic and theory courses are attended in person. And then, like I said, supervision meetings are virtual with the exception of the live observation that your supervisors will do at the clinic with you. Okay, so let's talk a little bit about our awesome faculty team. So you've met me already. I'm Fiona, the department chair and director of the MFT program. I use they, them pronouns. Alexis Hamilton is an assistant professor of marriage and family therapy. She's she, her pronouns. She teaches a lot of the really foundational coursework, like your foundational context class, your diagnostic class, human development. Dr. Sharon Young is a contingent faculty member. She's been with our program for many years and everybody loves her. She's a she, her pronouns. She teaches your Theory 1 class, which is your introductory theory class that also pairs with when you start to see your clinical clients or your clinical hours. Dr. Lindsay Neese has been with us for many years now. She's the associate professor of the Marriage and Family Therapy program. She also runs the clinic. And Qantas Ginn is our resident assistant professor, and he teaches classes like your Theory 2 course and human sexuality. Dr. Alexis Hamilton also is the director of clinical training. She is the one who works with you around your practicum placements and supports you during that time. So we all kind of have our own little corners of the program, but we also work together a lot to make sure that you feel really supported. If you want to learn more about any of our research or the things that we focus on, definitely go to our program webpage and look up more information on any of your faculty. Okay, some considerations for you. Minimum requirements for admissions. You do have to have a bachelor's degree from a regionally accredited institution. And then preferably you have a major in family studies, human services, psychology, or sociology, or social work with a minimum of 15 semester hours or 22.5 quarter hours in family studies or human services. That's credit hours, so just so that you can do that math. We love to see applicants with backgrounds in psychology, sociology, social work, sex and gender studies, but we are noticing that our field is expanding. More and more folks are getting interested in being mental health providers. And we do have a lot of second career folks. So if you don't come from one of these backgrounds, then you can work with our admissions teams about getting some prerequisite courses taken care of before you start the program. The strongest applicants do have some kind of experience working and helping people. So some kind of demonstration of working in a kind of social field. This could be paid or volunteer experience. We like to see that applicants have some kind of commitment that or demonstration that they've been working across differences. This could be working with folks in settings where there are people from different backgrounds coming together. That type of thing. And then really, really important for our program and for the field of mental health in general is that you do have a strong commitment to doing some self-work and some growth in your own mindset, being open and flexible with what you're learning, that you are somebody whose opinions could be changed instead of go unchanged. Because I think everybody underestimates that you learn a lot in this grad program, but the biggest thing you learn is typically things about yourself. And there is a big piece of self-work that comes with doing this. So applications are due February 1st, 2025. And then as applications come in, we will start reviewing and letting folks know if you receive an invitation to be interviewed or not by the end of February through the end of April. Then we will send you the interview date once we've gotten all those notifications out. And then if you get accepted into the program, classes officially start the first week of September. So it happens to go pretty quickly once we start the interview process. A few things about cost for students beginning in fall 25. The 48 credit program that we run here is $54,192 or $1,129 per semester. Credit, sorry, not per semester credit. Students may choose to do either a 5 practica theory sequence for an additional 2 semester credits. So these are folks who just need to draw out their program a little bit longer. And it tends to kind of work where about half of the cohort does the 4 practica sequence and half of the cohort does the 5 practica sequence. Students may choose to do an independent study research project for an additional 4 semester credits. And this tuition is based on a cohort model. So students must complete the program within their cohort to remain eligible for the pricing of the year you entered into the cohort. There are some additional fees. We have a technology fee, a wellness fee, a one-time matriculation. That's just like entering into the program, background checks, and AMFT membership, in addition to the books and materials that you'll need for the coursework. We do have financial aid available. Important that you also complete your FAFSA if you would like to apply for financial aid in any way, shape, or form. And we have a lot of different opportunities for scholarships as well. We've got our MFT scholarship opportunities. We have alumni scholarships available. We have a program scholarship called the York Storm Scholarship that get granted once a cohort. There's also the opportunity to graduate assistantships, otherwise known as work study. So if you're just interested in offsetting your course and tuition fees, then an assistantship is great. You also get to work closely with some of the faculty members. There are some rare international scholarships available for students who are coming internationally. And then we do at times have different grants going where folks also qualify for scholarships, and it just kind of depends on when you enter if we have those approved and up and running. And then depending on who you are, you might be financing your program through personal funds, maybe an educational loan, or even an employer-supported financial incentive or benefit, military benefits, and scholarships. So everybody's a little bit different. They're all coming in from different kind of phases of life and backgrounds, and so it can vary. Again, we do really recommend that you complete the free application for federal student aid or the FAFSA to be eligible for any of these loans. So please make sure to complete that. Okay, so we've been through most of that. If you have any additional questions, I really encourage you to reach out to Grad Admissions first. They're a great first point of contact for you. And then they'll also pass you on to us if any of the questions that come up are specific. I would like to just go back and talk a little bit about licensure. So as we kind of move along in virtual and remote work being more and more applicable, we just keep getting more and more applicants with questions about licensure. So our program is designed to meet the licensure requirements that you need for Washington State. However, there are different state requirements, and some of those are really well aligned with us, and some of them are a little bit different. So I'm going to come back to this accreditation page because this is what I encourage you to do. If you have a sense of the state you would like to get licensed in or practice in when you're done, or maybe you're planning on doing remote work and getting licensed in more than one state, it's entirely possible. If you graduate from our program, you'll be eligible to be licensed anywhere, but the route to licensure just depends. So, for example, California has some really specific requirements that are a little bit different from Washington. And so for them, you might have to take an additional course before you can do your licensure status, where maybe if you move or you get a license in Oregon, you don't have to. So it just kind of varies. So what I really recommend folks to do is actually start getting really familiar with the state that you would like to be licensed in when you graduate, or multiple states. And the most important thing to see is there anything regarding COAMFD accreditation? A lot of states, like I said, the COAMFD accreditation is a major piece. If you are coming from a COAMFD accredited program, that there are different licensure requirements than if you are not coming from an accredited program. So that is a huge asset to you, and it's important to understand. And then it's up to you to kind of figure out what are the specifics around that. In addition to the licensing or accrediting, or I should say licensing board of your state. So in Washington, it's the Department of Health, but in other states, it's sometimes a different government body that oversees the licensing process. I would also highly recommend that you go to AMFT and understand COAMFD accreditation, because they have some great resources on postgraduate licensure. Finally, there is a movement to get reciprocity across states. It is currently not in place. It is December 2024 right now. However, there is a lot of movement towards that. So I can't predict the future, but generally we are seeing more collaboration across states to get reciprocity for licensure, again, because that need for mental health services is so high. So again, we do our program meets the COAMFD accredited program standards, and we prepare you for full LMFT licensure in Washington State. That is very similar to many states in the United States. but it is up to you, the student, to go ahead and do some research and make sure that our program would meet the standards needed for yours. Again, you can reach out to grad admissions for any other info, and do not hesitate to ask us questions. We look forward to reviewing your application and look forward to seeing you soon.